guys, welcome to another episode of Legacy Speaks. We're getting into the thick of things today, right? Y'all, the pandemic is upon us and it is really real out here in these streets. I'm talking really real out here in these streets. Everybody's on lockdown with this quarantine and millions of people are dealing with some form of change all over the globe. And I really want to dedicate some time to anybody who is dealing with some form of loss in any kind of way, whether it's loss of a job, loss of hours, or even a loss of loved one. My deepest prayers and condolences go out to you and your family. As a mental health professional, I have the opportunity to be able to see all of this craziness from a frontline perspective. And so today I want to talk about what it's like being a mental health provider in this pandemic. As a mental health provider, I fall under the category of being an essential worker, and that's what I want to talk about today. Oftentimes when we think about essential workers, we are talking about physicians, we're talking about nurses, and praise God for you guys, praise God for all of those individuals. But I also want to provide insight as to how this pandemic is impacting us from a physical, mental, and emotional standpoint. Before we dive right in, I need you to hit that subscription button below. That way you can stay up to date on newly released content on a regular basis. So let's dive right in. So I'm really going to keep it real with y'all because I just want to talk about my own personal experiences as an essential worker within the mental health space. And there are 4 different concerns of mine that have really got me like, whoo, Lord, what are we doing it? What are we doing? But the number one concern for me is being exposed or potentially exposed to COVID-19 as I'm doing a lot of face-to-face care. Understandably and thankfully, we have telemental health where a lot of our mental health professionals are able to see our clients from a distance, obviously not only from a social distancing perspective, but actually physically being on the opposite side of the screen, which is just a beautiful resource. Thank God for that resource. However, that does not always work out or can be accomplished in multiple settings. For me, my day job, Monday through Friday, is at a nonprofit. So even though we get a lot of grants and resources, a lot of that money goes strictly to the care of our clients. And unfortunately, it's not within the budget for us to be able to provide our clients with the notepads or iPads or computer for them to be able to log in on different areas of our campus, right? Primarily because of the fact that, one, we have a lot of staff members that tend to the needs of the client. There's an emphasis on social distancing, and that can prove to be difficult when you don't have the space to be able to operate and do so. So what we've had to do is primarily have groups either outside or break them down. That way they can be within the regulated guidelines of 10 or less people. And I'm just speaking for me, especially with the fact that I have a little office. There's so much room that I have to work with. So what I end up doing is having my client sit on the opposite side of the room at the doorway, and I'm sitting all the way at the opposite end near my window. And that is just what I have to do on a consistent basis when I see my face-to-face clients. Now, when I'm working in my hospital setting, that is a lot better and a lot more functional because I'm able to do assessments over the phone. Oftentimes when we have walk-in clients, we send them to our nearest ER so that they can be evaluated and have their temperature checked and make sure that they have their travel screening as well. And obviously in the hospital setting, we're going to have easier access to a lot of PPE. I was readily available with gloves. I was readily available with the goggles. I was readily available with the face mask. Whereas in my nonprofit setting, a lot of that stuff we had to wait on, or I had to bring my own. For me, you already know, because I have a chronic illness, I stay ready, okay? You know what they say, stay ready so you don't have to get ready, right? I already had my gloves, I already had my Lysol wipes, I already had my Lysol, thank God. But I find it to be difficult, especially for other mental health professionals, to be able to provide these things while providing care. And that's another thing that I want to touch on as well. when you are on the front lines, when you are a essential worker, it's very difficult for you to make store runs on a daily basis. It's very difficult for you to be able to get the stuff that you need for your own personal home, right? Because you're working, whether you are working overnight or you're working your 9 to 5 or you are PRN, whatever, it's very hard for you to get the essentials for yourself. And especially for somebody like me, I'm single, I'm unmarried, I don't have any kids. So my time is literally dedicated to whatever space I'm in. Thank God for Amazon. However, things are selling out quickly. And so by the time I'm able to even get online, I see sold out, sold out, sold out, or this won't come in until maybe 5 weeks out, or maybe even 6 weeks. Like I mentioned before, because of the populations that I work with, I already had a lot of the materials that were necessary for me to remain clean and sanitized. However, my concern is that I may run out. Luckily, yes, with me being solo dolo, I don't have to worry about rationing out much, okay? A 6-pack of toilet paper will literally last me 6 months because 1, I'm barely home, and 2, it's just like, well, wait a minute, you know, like it's just little old me. Even with the little store runs that I was able to make, you can literally find yourself going on a treasure hunt, and my heart definitely goes out to all the elderly individuals and those who have limited mobility, because you can find yourself trying to go from store to store trying to stock up on the essentials. And that's very, very disheartening when you are finding yourself driving from point A to point B to C, D, and E, and you can't get what you need. And yes, I hear you, Amazon, whoop-de-whoop, but think about it. If you are a low-income individual, you probably don't have access to internet, or you probably don't have access to a phone that has quality 4G or 5G. So please, y'all, please, 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 please think about somebody else during this time. Get what you need. Yes, stock up for the well-being of your family, but please be considerate of somebody else. Or if you are going to stock up, at least dedicate a portion of what you were able to acquire to be a blessing to somebody else. Speaking of driving around, that is another concern of mine. So with the lockdown here in the state of Georgia, before we were officially locked down, we had a curfew in Fulton County, and that curfew started from 7 a.m. and lasted till about 9 p.m. at night. So that was your time to be able to go to and from work, or even go to whatever places that you needed to go to, like the store or the mall. Well, I don't even know why you would be in such a large contaminated place like that, but whatever, people did what they wanted to do regardless. And honestly, that was the problem. People were doing what they wanted to do regardless, and this ultimately led to the mandated shutdown. Anything that was not deemed a necessity for day-to-day living was not shut down. So your hospitals were still open, your laundromats, restaurants that allow for the option of dine out, all of those things remained open. Pause, okay? I just want to say that I'm grateful for the lockdown, but when I say all of my appointments were canceled, right? So my dentist office to have my braces retightened, that appointment got canceled. My retwist for my locks, that got canceled. A lot of my follow-up appointments for my doctors, those got canceled. I'm just like, oh my gosh, like what am I gonna do? I was freaking the hell out. Whew. All right, let me ground myself. Let me do some deep breathing, okay? Because I was like, I cannot be walking around here looking crazy. I cannot be walking around here looking crazy, all right? But yes, because of the lockdown, and even when we had the curfew, I became super concerned about being pulled over, because I'm not trying to get any type of tickets on my record whatsoever, right? Mama still gotta eat, mama still gotta get these bills paid. Like I mentioned, I'm not able to do telemental health with my daytime clients. So I was really kind of concerned, and I'm really grateful for the fact that I was able to bring up this issue to my supervisor, and now I have to drive around with a formal letter notifying them of my place of employment, as well as my tasks and my responsibilities, and why I am considered an essential worker. And granted, even though I was within compliance with Fulton County, my concerns started coming about when I was transitioning from Fulton County to Carroll County, which is where my other job is at. every county is different. Every county has different guidelines for their curfews and their regulations. So from my understanding, because I have a badge, my hospital badge shows that, hey, this is where I work, this is where I'm going, this is my shift. Please don't pull me over. Please don't ticket me. I am doing what I'm supposed to do. If you find yourself in this place as a mental health provider or just a provider in general, please make sure that you have your proper credentials on you at all times. Make sure that you communicate effectively with your supervisor or with the program manager of your department. That way they can provide you with something that you can have readily available just in case you are stopped on your way to and from work. Okay guys, I know we've only covered 3 out of the 4 concerns that mental health providers face as essential workers, but we're gonna put a pin in it and get right to it, all right? So stick with me, stay tuned for the next episode as we're gonna cover number 4. Obviously, it's super important. Obviously, it's a major concern because I had to create a separate video for it. Don't forget to stay connected via Legacy SBKS on everything, and don't forget to like, comment, subscribe, and share. Hit that comment section below with your mental health check-in, okay? Thank you so much for tuning in, and I can't wait to see you soon. Bye. I don't even know why I was freaking out, because y'all know I can do my hair, I can do my retwist with my ropes and stuff like that, but I was just like, oh no ma'am, I don't need you to run me my deposit back. To give me my stuff back. So because I really don't know when the heck I'm gonna be able to book another appointment with you, right? So run me my deposit back. Thank you.